Morning Talk on SAFM.
11:15 here on SAFM, South Africa's news and information leader. Time for us to speak now on a very key subject when it comes to the African continent, maternal deaths on the African continent. The United Nations has called on African countries to strengthen family planning programs as a way to reduce the number of women dying due to pregnancy-related outcomes. The UN's Dr. Bumi Makinwa says the misconceptions about family planning have exposed thousands of women to disease and death. Now, South Africa has launched a new campaign to reduce maternal mortality as an important step to address a very serious problem, but accountability is going to be the key to make it work, according to Human Rights Watch. And joining us on the line is Agnes Odhiambo, Africa researcher with the Women's Rights Division at Human Rights Watch. Thank you very much for joining us, and good morning.
Good morning. Thanks for having me.
Tell us a little bit about your thoughts on the campaign that has just been launched, a campaign for accelerated reduction of maternal mortality in Africa, and the theme being Africa Cares, No Woman Should Die While Giving Life.
Well, the campaign is being championed by the African Union Commission, and it originates out of the realization that very few countries in Africa are on track to meet the Millennium Development Goal of reducing their maternal death rate by 3/4 between 1990 and 2015. Bearing in mind as well that many countries in Africa have got very high maternal mortality rates. So the aim of this campaign is to mobilize political support so that leaders understand this is a critical issue, so that they talk about it, they put in place the right policies as well as the right resources, so that, they start addressing failures in the health system or in the communities that are contributing to maternal mortality. Other than the African Union Commission, there are other organizations that are involved, mostly the United Nations agencies, as well as we've got some donors such as, the USAID or the DFID that are involved in this campaign. And this campaign actually, while it's supposed to be driven by countries, it's supposed to involve all sectors in a country. It's the media, the communities, the government, the donors, so that they all come together and say, this is a crisis, we really need to address it.
Is it a welcome initiative in your view?
Well, it's a very welcome initiative in my view, because for a very long time, I think in Africa, we have viewed women dying during pregnancy or during childbirth as fate. If a woman dies, you say, it was just meant to be. But that is not the case. Women die because there are things that are supposed to have been done by the government, by the community, that have not been done. And so this campaign is very important in bringing that awareness amongst communities, amongst the women, to know that it is not inevitable for a woman to die during pregnancy, and to also say you have a responsibility, you have an obligation. Governments have international, national commitments that they have made to provide health care to pregnant women. So this campaign really makes everybody aware of the problem and for people to call for action from government. So it's really timely and it's really important.
You mentioned that all sectors need to be a part of this. Is there a buy-in?
There is buy-in because if you look at the situation right now in Africa, about 36 countries in sub-Saharan Africa have launched the campaign. During the launches, they have involved very high-profile politicians. They have involved government people. They have involved donors. They have involved NGOs, the media, women from communities. So I would say that it's really received well in the continent because it is valued and it's seen as very important.
You did mention earlier about statistics. Do we have enough reliable data to tell us how big a problem maternal mortality is?
Well, all countries in the world, including developed countries, actually do face challenges in gathering data on maternal mortality because there's confusion around what is a maternal death. Some women don't die in the hospital, they die at home. Some women, even when they die in the hospital, they don't die in the maternity wing, they may die in another department. So there are a lot of problems around gathering maternal health data. But I think there are countries that have made good progress in trying to get that information that at least can help to guide them. But in the case of South Africa, we're really faced with a problem of not knowing exactly what is the level of the problem. So last year, the Minister of Health, Dr. Aaron Motsoaledi, put together a committee that was looking at the data health problems in the South African health system. And they came to a conclusion that the current level of maternal mortality in South Africa is about 310 women dying for every 100,000 women that give birth. Now, this is a statistic that they revised from what they had reported to the UN, which was a figure of 625 women dying for every 100,000 women that are giving birth. Okay, so the 310 figure tells us, it gives an idea of what's happening nationally. But we don't have statistics, for example, on what is the problem in Mpumalanga, what is the problem, in Limpopo, in every province. And if you go to the provincial level as well, you need to know in each district what are the levels. Because the challenge with responding to maternal mortality is that you cannot have one strategy that responds to the whole country. You need to say, in Eastern Cape, the main problem seems to be women are not able to get to hospital when they're in labor because we don't have ambulances. And so there you say we need more ambulances. If you go to another province, you say HIV seems to be the biggest problem. And so you need responses that are targeted to problems. And if we don't have an idea of which areas have the biggest problem and where is that problem big, then it becomes very difficult to reduce the maternal mortality.
Agnes Odhiambo is Africa researcher with the Women's Rights Division at Human Rights Watch. 0891 104 207 is the telephone number to dial. And we are talking about maternal deaths on the African continent. We'll be coming back, taking your calls when we return.
Morning Talk on SAFM.
0891 104 207. Agnes Odhiambo, Africa researcher with the Women's Rights Division at Human Rights Watch. Are there any studies, Agnes, that have been done with regards to experiences that by women in the public health system when they are pregnant and are about to give birth?
Yes, in a number of countries in Africa, there are quite snapshots of studies that have been done on women's experiences. Human Rights Watch did such a research last year in South Africa, focusing on the Eastern Cape, and what we found is that women face a whole range of abuses at the hands of health workers. And to make it worse, that most of these health workers are not held to account. And when health managers or facility managers respond to health workers that are reported as abusive, then their responses are not really adequate. And this is something that has also been found in many other countries in Africa. There is no respect for women when they go to give birth. And that is a big, big challenge in terms of women being able to access quality maternity care, which as well also contributes to women dying or getting injured or babies dying during childbirth.
With regards to legislation, is enough legislation there to protect women?
Well, you have legislation, for example, around violence against women, although often this does not include violence that women face in health facilities. And then you've got, legislation around assault, the usual criminal offenses that you can bring forward. But, legislation alone cannot really solve the many complex problems in the health system. There have to be programs that target communities, that target women to know their rights, to say, look here, when you're pregnant, these are the services that you need to get. This is how you're supposed to be treated. Women need information to say, if you're not able to get these services, then this is who you report to. And when women report those problems, they need to be acted upon. At the same time, you need programs that say to health workers, these are women's rights. this is how you're supposed to treat them. It is important to treat women in this way because then you have women dying unnecessarily. It is expensive for the health system. It is expensive for the family. It is not good for the development of the country. So you need programs that target health workers, that target communities, that also sensitize government on the importance of monitoring that these programs, these systems that they have in place are working. So, for example, in the Eastern Cape, we found that the provincial department has a complaints policy that says if you're not happy with the services offered, if you're mistreated, you need to report. These are the steps that you need to follow. But we found that women don't know about those procedures. Health workers themselves don't even know them. They don't even understand the importance. So you can have laws, but information, dialogue with everybody is really important because there are very many factors that lead to these abuses.
The study itself and the results that came out, did they contain strategies and recommendations on how to go about introducing those programs and highlighting the rights that women have?
Yes, we did. We have a very big section in the report that's about recommendations that are targeted at communities, that are targeted at health workers, and that are also targeted at health managers. Because what we found in the course of doing the work is that you have health managers that are constantly blaming the health workers. But you also have to ask yourself, if this health worker is able to abuse women consistently, then what is the role of the supervisor or the manager of that facility? Are they not aware of what's happening in their facility? If they are not aware, it means that they're also not doing their job. And if they are not responding to that problem, then it means they're also sleeping on their job. And the other thing as well, for example, we're finding that the responses that some of the managers were having is that they discipline the health worker. So if a nurse has shouted at a woman, they will call the nurse to apologize to the patient. But if you have situations where these women continue doing this, then as a manager, you need, for example, to ask yourself, what is the level of supervision in this maternity ward? Is there no one walking around looking at what is happening and trying to make sure things are in order? So we have a whole range of recommendations of what needs to be done to engage communities, what needs to be done to engage health workers, and also some of the policy systems that the government needs to put in place.
In your experience, you question the issue of supervision. In terms of accountability at those institutions, are there people that really do take accountability seriously?
Well, we found that actually accountability was not being taken very seriously. And there's a misunderstanding about what accountability is, because accountability means that you're identifying problems and then you respond to those problems so that they stop occurring or they stop recurring, okay? So accountability is at two levels. One, to the health user, and two, to the health system. To the health user in the sense that if a woman is abused, then, you need to apologize or say that, we are sorry, this is not going to be done again. The abusive health worker should be reprimanded or held accountable in another way as defined by the policy or by the health system. As well, you need to, and the most important is that you need to put mechanisms within the health system itself so that women are not abused. So like I was saying with the supervision, if women are abused and there's no supervision in the maternity ward, even if you make the nurse to apologize, the problem will never stop because there needs to be someone who is monitoring what is happening and responding to that. If women are waiting for 8 hours to be attended while they're in labor because you only have 1 or 2 nurses at a health facility, unless you can increase the capacity of that health facility, women will not stop waiting. So accountability is much more than I'm abused and someone apologizes. It's looking at the whole system mechanisms. What can we put in place to make sure that this does not continue happening? So really analyzing them at that deep level. And we found this was not happening. We found also there was a lot of blaming and counter-blaming where you have health workers saying it's the manager who is not giving us this. And then the manager will say it's the district level. The district level will blame the provincial level. So you really don't know where actually real accountability stops with who. It's not very clear.
Agnes Odhiambo, Africa researcher with the Women's Rights Division at Human Rights Watch. We've been concentrating on the human element. And I'd like us to come back and talk about facilities. Do we have adequate facilities that can also handle emergency cases?
Morning Talk on SAFM.
We're still in conversation with Agnes Odhiambo, Africa researcher with the Women's Rights Division at Human Rights Watch, and we are talking about maternal deaths on the African continent. And Agnes, we've been talking about the human element, but looking at facilities, what is the state of facilities?
Well, many countries in Africa really do not have enough health facilities. And we have to bear in mind that when you have health facilities, you have to make sure that those facilities have the capacity to provide the services or the care that pregnant women or women in labor need. The WHO, together with a number of international experts, for example, have given some guidance on the number of facilities that are needed and the population that facility is supposed to cover, the services as well that they're supposed to provide in order to be able to attend to women properly. And so you find that sometimes a woman has to travel 50 kilometers to go and give birth. This is a big problem in a majority of the countries in Africa. In South Africa, there's a problem, but it's not as big compared to other countries. And so for me, really, for South Africa, the priority should be to strengthen the services and the care that women receive in those facilities. For other countries, there's need to improve on the number of facilities and also to improve on the number of health workers. And when we talk about health workers, we need health workers that have midwifery skills, who are able to deal with a woman who is pregnant. Because if you bring a health worker there who does not know how to help a woman give birth, who does not know how to resuscitate an infant, then it's not going to make any difference. So health systems, having health facilities is important, but I really want to stress that even with health facilities, unless we pay attention to the quality and the respect for women, still we cannot reduce maternal mortality. You have countries like in Kenya, for example, where I come from, in Western Kenya, we used to have a big problem where the clinic is 5 kilometers from women in the community, but the women don't go to give birth there. They give birth at home. And people are concerned that what is the problem here? The facilities near where are women not going there? Then the women say we are abused, they don't respect us, they don't treat us with respect, they shout at us, they say we are dirty, they tell you to do all sorts of things. So having the facility is one thing, but making sure that it meets the expectations, the needs of women is also important.
0891 104 207. You might have had experiences at hospitals or health facilities and you'd like to share those with us, or you might have something to add to what our guest has been saying. Agnes Odhiambo, Africa researcher with the Women's Rights Division at Human Rights Watch, and we're taking your calls 0891 104 207. And Agnes, just talking about strengthening what we have currently here in South Africa when it comes to facilities. What aspects actually need that attention?
Well, as I mentioned earlier, we have the need to really consider how we treat the women, that human aspect, the respecting women, treating them with dignity is important. As well, in parts of South Africa, there are areas also where you need more health workers. There are also areas where you need more health facilities. There are areas where you need more money to buy supplies, equipment. But I would just want to go back to the point you made about strengthening health systems and how we can reduce maternal mortality. Often, and at the beginning you talked about, the UN calling for family planning. But while family planning is important, actually, it is not the only method of making sure that women don't die just because they get pregnant. When you talk about helping women to go through pregnancy and childbirth safely, you have to look at the sexual and the reproductive health needs of women from when they are girls. Are you giving girls information about sexuality education, for example? Having comprehensive sexuality education in schools is important so that girls make informed choices about how to have sex and about how to reproduce. Then when you move from there, you're talking about access to contraceptive information and services, so that if a girl is sexually active, then she knows this is how I need to protect myself, so that I don't get pregnant when I'm not ready to have a child. Then you continue. If the woman is pregnant, then what services do you need to give to that woman? You know, antenatal care, there are drugs that you need, there are health workers that you need. And then you move at the point where the woman is now giving birth. What services, what human resources, what equipment do we need? And then you move to after the woman has given birth, what do we need? So while family planning is important, there is no one strategy that has been shown to reduce maternal mortality in any one country. But a comprehensive package of all these services is needed. All the same, at the point when the woman is pregnant now, international experts agree that providing services at the point when the woman is now giving birth is very important, because most women die during labor and after they give birth. So that moment is very critical once the woman is pregnant. But before the woman gets pregnant, there are also other issues that we need to address so that the woman is ready to have that child.
Agnes Odhiambo, Africa researcher with Women's Rights Division at Human Rights Watch.